My name is Eric Skindred. I'm with the Hospital Association of Southern California. As part of our ongoing In the Spotlight series, today I'm speaking with Aizita Magaña. Aizita is with LA County Department of Public Health. She is Director of Planning and Public Partnerships for the department's Vaccine Preventable Disease Control Program. Welcome, Aizita. The first question is simply, Aizita, introduce yourself a little bit and tell us what you do.
Hi, Eric. Thanks for taking time to talk. Well, regular time, I'm just trying to work with the public partnership agencies, communities to promote and share information about vaccinations. So all types of vaccinations, both for children, teenagers, and adults. During this time, my focus has been on COVID-19 vaccine. Prior to that, right before that, it was on flu. But right now, we're focusing on communications and messaging related to COVID-19 vaccination.
Thank you. Well, of course, that's a critical role right now. So thanks for giving us some time to chat. Tell us a little bit about how hospitals, clinics, and others tasked with delivering vaccines can gain people's trust and help overcome some of the inequities in distribution that we've seen so far. Actually, today and this week in the newspaper, we've seen multiple stories discussing this issue. Why don't you give us your take on it?
Well, I think the issue of vaccine competence and acceptance, it existed before this vaccine, but certainly it's all present now and important now. I think logistics are one thing, which is we have to make the vaccine accessible. It has to be relatively easy to get an appointment, to know what to expect when you get your immunization, to know what documents to bring with you, to know what's going to happen, to know more about the vaccine itself, side effects, what to expect, the benefits, the safety, all of that. But it's also an issue of confidence. So the vaccine has to be where you live, and it has to be a place where you can get it, regardless of whether you can drive or whether English is your first language, whether you use the internet or have a smartphone. The vaccine has to be accessible to you. And it's going to take a lot of different partners to make that happen. And then this issue of confidence, really strongly believe that human beings respond better to empathy and patience and respect than to pressure or scare tactics or shame. So we have to lead first with all of those things when we encounter people who may have some hesitancy, or we like to say confidence issues with the vaccine, and to know that that's a very reasonable reaction given some of their very current experiences with the government, with healthcare, with public health. And I think that when you look at the people who are declining the vaccine, there are very few hard no's, and those exist, and I'm not going to say they don't, but more often we have a pool of people who are in a wait-and-see mode, which they are waiting to see how people react to the vaccine, if it's safe, or people having side effects, allergic reactions, etc. So I think we have a lot of opportunity to encouraging those people to provide information about them in a way that makes sense to them, that is relevant to them. Not everyone needs an FAQ. Some of us need a video. Some of us need a radio ad. Some of us need a conversation with a coworker or a friend. I'm also a strong believer that decisions are made about the vaccine in the context of our community, people we live, work, and know, and that you are having issues. If you're not sure, if you're in that wait-and-see group, that what will change your mind? Is it going to be the latest data about the clinical trial or even the side effects? And I'm not saying that's not important. Of course it is, and people want and need that information. But it'll be the reassurance and guidance and support, usually of someone you know. So all those testimonials, all the people you see around you being immunized, it really helps. So this is an interpersonal human decision. We need to support that process along with the information sharing process.
That's very interesting, and I noticed early on you used the word empathy. I think you touched on some of the ways that empathy could be implemented in the process, but do you want to say anything more specifically about that?
Well, empathy and understanding, and really just acknowledgement that the people who have been disproportionately impacted by this virus are the same people now who are having a lack of equity in receiving the vaccine. So we have a lot of illness, death, and hospitalization from the virus among lower income African American, Latino, other people of color communities, among essential workers. So we have to have empathy and understanding and acknowledgement that the response has not always been adequate. It's been really inequitable and not adequate oftentimes. So I think we need to just be aware of, acknowledge, and empathize with the fact that anything new, something new, is not always what people are clamoring towards right now.
Thank you so much, Aizita. It's been a pleasure to chat. I'm sure our members will find this of great value. So thanks again.
Thank you, Eric. Thanks for your time. I appreciate it.